Hey everyone, we have the epic question today of how do I know if I need therapy? We get this question so much and I'm really excited to talk about it today. So need is relative, right? Therapy, there are times when it's a need. If you are feeling any life or death thoughts, symptoms, if anything you're feeling or thinking is interfering with your day-to-day functioning. So for example, your lethargy or your fatigue is interfering with your ability to show up to work, or your lack of appetite or over appetite is interfering with your ability to eat what you consider to be a normal regimen, or you're veering very far from your normal, regular routine. If things are interfering with your interpersonal relationships to the point that you cannot connect, or that a lot of conflict is causing you or someone else any amount of danger, those are needs that you should address as soon as possible. There's a lot of gray area between something pointedly interfering with your day-to-day and not feeling great, right? And sometimes you might feel, I'm so tired and I feel tired that I can't focus the way that I know that I used to. Is that enough to go to therapy? Or I'm noticing that I'm having more arguments than usual with my family or my loved one or my friends or my coworkers. Am I just a little testy lately? Is something wrong in any of those environments? Is something wrong with them? Is something up with me? This is where some of these question marks start to get, like, I'm just not sure. Now, if you're even considering going to therapy, I would recommend it. I would recommend at least giving it a chance. Now, one of the really amazing benefits of therapy is you get to know yourself so much better. So it can be a huge privilege and it can be a huge asset for your personal life and for your professional life, whether or not you quote unquote need it. So for example, if you're finding that irritability is really high and your fuse feels a bit shorter than usual, without therapy, without any experience in therapy, or without any outlets, without any spaces for self-reflection and learning and growth, you might be really confused and overwhelmed. So the short fuse itself starts a cycle of causing more of a short fuse, where maybe you lose your temper and then you're so groundless and confused and anxious about having lost your temper that you're more likely to lose your temper. And then you're more likely to lose your temper, so you're more anxious and stressed about losing your temper. So something that therapy can do is it slows down that cycle and it introduces curiosity at every single step. So maybe you've lost your temper. We think about in partnership, what happened just before that? What was the seeming trigger for that loss of temper? Are we not sure? Like, okay, what have been occasions where maybe you've lost your temper in the past? Does anything come to mind? Is anything really familiar? Is anyone in your family, in your love life, in your early childhood, have they had occurrences of losing their temper? How did people around react? What was the perceived reception of that behavior? And these are some of the questions where you really start to learn and you think, so actually, maybe this loss in temper is in direct relation to something that's happening in your environment that you might want to change. Maybe it's in relation to something that's happening internally that needs more of an outlet, needs more acceptance, or needs more support. Maybe it's something that you've inherited that actually might have very little to do with your surrounding environment or your internal makeup, but you've inherited it and you want to practice curiosity to better understand it, better accept it, and give it the love and support that it needs, even if it didn't originate with you. So for all of the ways that that can sound a little bit odd, a little bit confusing, if you are even considering going to therapy, it can be a tremendous asset that I strongly recommend at minimum giving a try. And the thing that you're going to want to keep in mind is your fit and your rapport with your provider is really important. So go out there, try to find a few providers. We are, of course, happy to help at MyWellbeing. Get to know them, have a brief 15-minute phone consultation. Most providers offer the phone consultation complimentary. Ask things like, what is it like working with you? You can even ask, how do I know if I need this? What should I be keeping my eyes out in my day-to-day? Eyes out for, ears out for. So coming full circle, absolute need. If your life or the life of someone else is at risk, it is an absolute need. In fact, it's an emergency. And you should visit an ER, you should call 911, you should use crisis resources as soon as possible. If anything in your day-to-day has significantly changed or is being interfered with, but it's somewhat manageable and it's not life-threatening, that is still a need. If your sleep habits have significantly changed, if your eating habits have significantly changed, if your relationships have significantly changed, pay close attention to that and seek support. You deserve it. If you're in the gray area and you're like, I just don't know, I feel tired, I feel stressed, I'm unhappy, you deserve care. You deserve happiness, you deserve whatever it is that you want. And at minimum, you deserve to better understand yourself and to create a home within yourself that you can always return to. And that is ultimately what therapy is for. So I hope today's talk is helpful for you. As always, let us know what you think, what your thoughts are, what your questions are. Share your light bulb moments with the community in the comments. And let us know if any questions remain for you that you'd like to talk about in the future. We're so looking forward to continuing the conversation and wishing you a really grounded and love-filled rest of your day. Talk to you soon. Bye.